We'll wait 1 or 2 minutes for people who want to join, then we're gonna start. We'll just wait 1 or 2 minutes. So if everyone keep their mic and camera off, so people can join easily. Otherwise, internet can be collapsed. So I really requesting again and again, keep your mic and camera off. We are waiting for hi everyone. So Najiba, are you there? Because I can't see you. The facilitator is Anila, which is me, and Najiba and Shaza. So we gonna keep our cameras on while we are talking, and we are requesting everyone else to keep their cameras and mics off. And so we just wait 1 minute, and then we're gonna start. So thank you so much for already who are joining. So we'll wait only 1 minute, and then we'll start. So Shaza, I request you to start the
Okay.
conference. Yeah, thank you.
Hello, you hear me? Hello, everybody. Hello, everyone. Good afternoon, good morning, good evening for everyone. It's our pleasure and privilege to welcome all of you in this unique gathering, which will bring all together the key representatives from the refugees communities and the stakeholders, international and national organization on the most timely topic of the common interest, the COVID-19, and how the refugees are responding to this. I will try to ask everyone for some logistics during our conference. Please do do mute all these videos and mics during our call because we have a lot of participants and we need this call to go smoothly since we reach more than 150, for example, we can say so now. And again, please try to check your chat box if you need to write anything or if you ask any questions so and make on any comments. Also, I would like
Awareness
to
to
ask,
empower refugees to provide their reply.
hello, and hello.
Yes, go ahead, Shaza.
Okay.
Yes, we can hear you.
Uh, yeah, okay, good. And for everyone, just to know that this call will be recorded. So also we will share it after our live stream now. We will share it with everyone. So this call will be recorded. And for everyone wants to do any comments on the chat box, please try to write your name and your affiliation so we can know who is the speaking. Now I would like inviting everyone to be ready because we are taking off, and I will give the floor for Najiba.
Thank you, Shaza. Similarly, I would like to welcome everyone to this conference call. My name is Najiba. I'm a former refugee from Afghanistan, and as well as my other colleagues in the call, are part of the steering committee for the Global Refugee-led Network, GRN. So formally, it is quite exciting for us to hold the first virtual global conference to bring refugees from all around the world to discuss on a very important crisis that I'm sure every one of us are dealing in many different countries that we live in. So on that note, I actually want to give a little bit of information as to why we actually have held this global conference, and why is it that we are here in this space trying to talk about the refugee leadership in COVID-19 response. I'm sure, as most of you know, the COVID-19 pandemic is not just a health issue. It is definitely a profound shock to our societies, to the economics, and obviously refugees, unfortunately, are once again hit much harder during this crisis. We all know that refugees are at a greater risk of infection, and in many parts of the different regions that we live in, we continuously hear from a lot of refugee groups and refugee communities that they're having inadequate access to health services, they're having inadequate access to medicine or sanitation materials. We hear from a lot of women that they're not receiving enough information around how to respond to COVID-19, and many other issues and challenges, which I'm sure there will be an opportunity for all of us to share on those challenges. I guess, for us, the Global Refugee-led Network, we have created this platform, firstly, to bring all of us, all of refugees from many different parts of the world, to come together and to listen to one another, to actually share, how are we responding to COVID-19 crisis? What are we doing on the local ground, and what kind of needs are to be prioritized by a global network like GRN? We will hear from a lot of speakers during this conference, around some of the initiatives that they have taken at local and regional and international level to support their communities in response to COVID-19. So this conference is going to be a very interactive conversation for many of you, and I really do encourage everyone to speak through the chat comment box. As you know, this is a virtual conferencing, and the number of participants are quite high, and therefore unfortunately we are not going to be the technology will not allow us to have much more of an interaction conversation verbally through the call. Hence why I encourage you all to use the chat comment box. We will be recording all of those comments, and we will be actually using them in our reporting at the end. On that note, I do understand that we've had a lot of new participants from a few of the countries in the world that have registered for this global conference. And for those of you who doesn't know about GRN, I would like to give a very small briefing as to who we are and what we do, and you'll be able to hear a lot from our other colleagues from GRN as well today. So for those of you who don't know, GRN, the Global Refugee-led Network, is a global a network that is made up of 6 regional chapters. It's a network that's made up of refugees that works for and with refugees. Currently, we have 6 regional chapters that work under our umbrella. And as you can see in our PowerPoint presentation very soon in the next slide, that GRN has a global footprint. And for us, one of the main principle or vision that we have as a network is to increase participation, to create spaces for refugee engagement in a meaningful way. And we've tried to do in the past few years of establishment as a GRN, we've tried to take different methods to ensure that we are able to amplify on the voices of refugees. And we've done it through the summits, as you can see within this slide. We've held held so many regional summits, and some of you who are on the call have been participants to these summits. We do have the Latin American Summit and the North American Summit in progress, which is going to happen soon. It was meant to happen during this time, but unfortunately, due to COVID-19 crisis, we were not able to pursue or proceed with the summits. GRN has done a lot of advocacy in terms of meaningful refugee participation. We have basically produced a document called a manifesto. A manifesto is basically it brings all the key recommendations from the regional summits into a living document, which we've called it the manifesto. Within the manifesto, we are actually giving clear recommendations as to what the communities has asked or think to be solution to the situation that they are dealing with. It looks at 5 key pillars around which are education, livelihood, pathway, engagement, and solution. And I really do encourage those of you who don't have an access to this manifesto document to actually send us an email. Myself and Anila will be more than happy to share the manifesto with you. As I said, it's a living document. It's a document that brings the voices of people from bottom-up approach. It's very similar to the Global Compacts on Refugees document. I think the difference that we, the GRN, would define between the GCR document and the manifesto is that the GCR was actually produced as a top-to-bottom approach, but our manifesto is produced as a bottom-to-up approach. So the voices from the local that are actually shaping the recommendations and shaping the solutions. So I really do encourage you all to have a look at the manifesto. If you don't have access, please do let us know. Similarly, just in the Global Refugee Forum, which GRN attended in December 2020, we were able to make a global pledge, which has become a multi-stakeholder pledge on meaningful refugee participation. Our pledge was that we want to make sure that in everything that we do, in every decision that's being made, either by governments or by NGOs or by national actors, we want to make sure that the refugees are put at the core of those decision making, that we have a true and genuine and meaningful engagement of refugees. And with that, we've been quite fortunate to have 4 governments signing on that pledge. And I do understand that some of those government members are also on board as observers on this call. So I do thank their support with our pledge on refugee participation. And those countries who have signed are Canada, Denmark, Australia, and the Netherlands. And this is again a pledge which is a progressive way to work on. For us, we are using this pledge to actually try to change, the international processes, the regional structures, and the local processes to include much more of a systematic engagement of refugees within this local, national, and international structures. At the same time, as GRN has been doing a lot of other work in terms of community engagement with their local and national actors, I'm not going to share much more around what GRN has done in broader aspects, because I do understand that there's an agenda item where we will provide much more opportunity to GRN colleagues to share and provide more information around some of the activities that has taken under GRN as well as the regional chapters. So I will leave it there, and I probably invite my colleague Anila to actually take us through the agenda today and what are we expecting to hear.
Yeah.
Anila?
Thank you, Najiba. So everyone, before I start, I really request everyone to keep their cameras off and their mics off, because we're gonna have so many people who are joining, so we don't want this call to be collapsed. So kindly keep your cameras and your mic off until we facilitator asks you to come and speak. So kindly keep your mic and cameras off. And as Shaza said, this call is being recorded. So please remind this call is being recorded so we can share further. And kindly keep your cameras off. I see some playing chat from that someone. So please keep your camera off. Okay. So before going through the agenda, I really like to share how we come up with this agenda, because when we start this call, we put application through Eventbrite, and in Eventbrite we put a different kind of question, and people respond according to this question, and there's we have amazing, excited, overwhelming response from refugees, from multiple stakeholders, from donors, from so many INGOs and governments. So we're really thankful. And I'm so excited to see, even when we were joining our call, setting our call, I saw so many people already there in the call 20 minutes ago. So I really appreciate. Thank you so much for appreciating and for giving a very positive response. Because we really want to create some kind of space, refugee-led space, and we really want to have intervention from refugee lands. This why we are having this conference. And this conference, the agenda we put it. We really want to give our chapter, regional chapters. So we have our regional chapter. As Najiba said, we have 6 regions. So we're gonna have each region intervention. They're gonna give their updates. And after that, we have a partnership and solution, because when we put our question about what is important for refugees, is this consultation, is this collaboration, empowerment? So we saw more than 200 people, they really respond, though consultation is important, but partnership is also very, very important, and they really need more resources, the work which they are already doing in their local realities. So that's why we are talk about that as a solutions. And then in the third part, we'll talk about collaboration and coordination, like how we can create more, maximize our collaboration, and how we can more inclusive coordination. So we'll talk about that. So let's go forward, and I will go to our regional chapter. So I will like invite to Najiba to introduce us to our MENA region, and we have our MENA region people ready, I hope so. So Najiba, over to you.
Yeah, I mean, with that, I would like to call on Mahfouz, if you're on the call, to actually introduce yourself and to provide us with your regional update on the MENA region. Do we have you, Mahfouz, on the call?
Can you hear me?
Yes, we can.
Yeah, good morning, everyone, and of course, I want to reiterate as well, welcome to everyone who joined us in the call, as my colleagues Najib and Anila and Shaza just said. We see it's very important initiative, but especially in those difficult times. So we're also sending hugs and regards to every one of you, wherever you are. And to start, my name is Mahfoud Mohammed Lamin. I am originally from Western Sahara, and I'm a refugee in Algeria, particularly in the Tindouf city of Algeria, in the southwest part, together with more than 170,000 Sahrawi refugees who fled like 40 years ago from war and conflict, which is still ongoing and which is preventing them to go home. So basically, as all the world, we are also very concerned about this Corona issue and COVID-19 issue, basically, and most importantly, because of the lack of infrastructure, because of the vulnerability of the camps where we are living in. And hopefully, up to now and up to the moment, there is no registered coronavirus cases in my camp, and this is due to many prevention steps that was done by the Sahrawi community. And as many of you may know, this is one of the, let's say, refugee-run camps. So the refugees are running themselves in all the different aspects of life. So at the very first moment of the spread, the outbreak of this coronavirus, a committee was created in order to follow up, and this prevention committee, let's say, have taken so many steps up to now. And from 2 weeks now, Sahrawi refugees are in confinement in their homes. But also, and most importantly, now many civil society organizations are working to, let's say, to raise awareness and sensitize refugee community about the danger of this coronavirus, but also the importance of many steps to be taken, especially social distancing and also hygiene, etc. So there are many efforts done by these refugee-led organizations, basically, to sensitize the community. and together with many other steps that are taken by those by these refugee-led organizations, and which is a very good experience, and also try to which show to us how important is solidarity basically in this important and in these difficult moments. I basically focused particularly in the camps where we live. I am based, as you know, in North Africa, and with the hope that we are gonna have a colleague also from basically from the Middle East, and also and basically talking particularly about the Syrian refugees in Turkey, in Lebanon, in Jordan, and other places, and how Syrian refugees and other also refugees among the MENA region are, let's say, facing this pandemic. And I don't know whether Sana is in the call, because she was supposed to speak about the Syrian part, let's say, Syrian refugee part on and how they're confronting the COVID-19. Sana?
Sana from the Mahlam, are you online? Just checking if you are, you might need to unmute yourself if you're speaking. Do we have Fadi from the Basma Zaytuna? Fadi from Basmi and Zaytuna? And can I kindly ask you to unmute yourself if you're speaking? Sana or Fadi? Do I have you guys on the call? No? So Fadi and Sana, do I have you? Or so I think you have the floor, Basma and Zaytuna. I can see you messaging me, so are you able to hear me? Okay, so my understanding is maybe we'll come back to you and provide you the floor later, or maybe we can go to Mina, and then we'll probably will come back to this region again
We
to
have
hear
someone,
from Sana.
Najiba, sorry. We have someone
Yeah, Mahfouz, go ahead.
we have someone who just said that he's working with Syrian refugees and they can provide some updates from there. Maybe we can give a chance to speak. Ola Bata now in the chats to speaking.
And who's this person, Mahfouz?
I don't know him, but he just texted in the chat.
Okay.
Yeah.
We will have. Sorry. We will have more opportunity from the floor to have more engagement.
Okay.
Maybe what we'll do, we will go to the MENA region. We will come back to the MENA region to hear either from Fadi, from the Mahlam, or from Fadi from the Basma and Zaytuna, or from Sana from the Mahlam, and we probably will go next to the Africa region. Anila, back to you.
Yes, so thank you so much. This is internet is giving us more space, but sometimes really make us dependent on how to make the compromises. So we're really trying to figure it out how to solve this. So Robert, are you online? Robert or Milingo from the African chapter of GRN region? Robert?
Yes, I'm online.
Yes, good.
I don't
Yes,
know.
over to you. Over to you.
Okay, thank you so much. And I would love, first of all, to thank everyone who is connected now to this very important meeting that bringing together so many refugee leaders across the globe. This is really a very, very good and important initiative. I know we don't have much time, but I would love just to introduce myself and then to talk about briefly about what we are trying to do as a refugee-led organization in African region in this period of time. So my name is Robert Hakiza. I am originally from Congo, but living in Uganda for the last 12 years as a refugee. I am the co-founder and the executive director of a refugee-led organization called Young African Refugees for Integral Development. And I'm also a founding member of the Global Refugee-led Network representing the Sub-Saharan region, together with my colleague Bolingo, who is also online. What I can say briefly, I know as everyone is saying, what is right now on top on the news and that is affecting everyone, the COVID-19. I can say that refugees and especially African sub-Saharan region, we are not spared because right now where I am in the country, for instance, there is a total lockdown. So people are not allowed to move, all the schools and the market and the public gathering are not allowed. And the good thing is because of the country where I am, there are not too many cases so far. I think the measures that are put in place by the government are helping, I can say, because we are only at 52 cases. So the African region for the chapter of the Global Refugee-led Network, I can say we have other colleagues who are in the southern region, we have colleagues in East African region, and we have a colleague Western region. And since this crisis has started, I think we have had two calls, and which we had to discuss about what are our responsibilities in this period of time as a refugee-led organization and the leaders. And we discussed about a number of things, and one of them was to see how, as much as we can spread the information, because we've realized that the major challenge that the refugees are facing, because there was lack of information. People do not have really good information. So we encourage members wherever they are to create to use the social media and all other network to share the information in the languages that the people, based on their respective region, the language that the people can understand. And what has happened right now, I think it's very, very good because so many of them, from so many of our colleagues in Southern, Eastern, Western, they have created and they are sharing whatever information, useful information they are getting as far as the COVID-19 is concerned. The second thing we are looking at how can we cope up with the fact that, for instance, here in Kampala, where we are, refugees are not allowed to move, yet many of them live on daily basis. That means if they don't move, they cannot get anything to eat. And from there, we've had colleagues, and especially our self-refugee-led organization here in Kampala, like since last week, we've been distributing food directly to the most vulnerable refugees. Of course, we know there are so many. In Kampala, for instance, we have more than 70,000 refugees, which is practically impossible to give food to everyone. But we've been identifying the most vulnerable people, like the elderly, the people living with disability, the people with chronic diseases. And so far, we have managed to give food to over 200 households, which is good. We are giving both food and non-food item and non-food item. So what we are trying to do, because we are not allowed to move, there is no public transportation, so we are using the motorbike. Like after identifying the people where they live, we send the motorbike to go and share food door by door. And at the same time, whenever we give food, we take 1 or 2 minutes to share information of the people about the COVID-19, and this is something that is working very well. And my other colleague, I don't know if Jean Paul is on this call, they're also doing great work on legal support in this period of time in Kenya. Maybe if he's in call, can also share. And I don't know whether we have other people, because there is also a problem of net. I also took also to almost 20 minutes to connect myself because of the internet connection, which is very poor our side here. So let me stop from here, and if there is any Jean Paul, Jerry, or Bolingo, if they are there, they can also complete. Thank you so much.
Thank you,
Thank you,
Robert.
Robert. We like to invite Susanna if she's there from Africa region. Susanna, are you there? Okay, then we like to move to our European region of European Coalition, which is also part of Global Refugee-led Network. Sure, Shaza, hand over to you to give us insight about European Coalition.
Thanks, Anella. Hello, everyone, again. We and the European Coalition, working as a GRN chapter in Europe on communicating and collaborating with the other refugees in the region, and we are trying to help them by so many resources, like talking to other organizations, trying to help them to have some fund from here and there, or link them to other donors, something like this. And we, as everyone knows, that Europe is now the pandemic areas, and the highest number of people are affected by this corona or COVID-19. We are trying to talk to everyone how the refugees are treated during this crisis, and we have so many information about people, like especially in the Iceland, in Greece, and how they are really suffering. There is nothing for refugees there, and we trying to link these people to this international organization or EU members, or some kind of support we can reach it. I think we can give more information about the European situation from other colleagues who were working in Italy, like Tarek. And then we have also from some information from Rashad. I will call Tarek to share with us his inputs. Tarek from Italy. Or maybe we can give the floor for Rashad, then we will see if Tarek is here. Hello? Because also our friends from Greece are not here as well, because of the connection, maybe, as we agreed to have some information from Greece, how the refugees there are treating refugees in the situation there. So, Rashad?
I can say something
Okay.
from Greece if you want.
Jen, yeah, you are here. So happy to have you.
Okay. Good afternoon, everyone. My name is Jean-Didier Toto, the president of Congolese communities and also the president of Greek Forum of Refugees. So I would like to thank you for this initiative to collecting information from different refugees community and to be able to share some information, because somehow we have to face almost the same challenges. So I will briefly talk about the situation here in Greece. We have three different situations. Firstly, we have the situation in the mainland and in Athens and in others region, and we have also the situation in the island. And another situation is in the camp. So in the island, we have some official information of COVID-19. We have about 20 cases that have been confirmed, and we are still waiting for others confirmation from some hospital over there. And if, as you know, the camp in the island are closed, so there is no access to the camp. No one can go inside except for some special services, and no one can go out the camps. So to prevent people to interact and to spread the virus, so the government took this measure. But still, the service are in. There is no very good level of service, if I can say that, in the camps located in the island. And the situation is almost the same in camps that are located around the region of Athens. But over there, we can communicate with the organization that are responsible of those camps in order to see how we can help. And in Athens and in other cities on the mainland, refugees are organized in communities. So we have we used to organize a meeting with each community representative in order to collect some problems and to see how we can work together and to help. So the main issue that we collected until now was regarding the lack of food and also providing some basics needs for new mothers. So we started by organizing a distribution of food by having a relation with some shops that belongs to refugees in some area. So we are providing people in need some identification code, and the same code is sent to the shop, so they will be able to go there and to receive what they need. And so this operation will be extended to many parts of the country by having a contract with some supermarkets of the country in order to be able to provide vouchers that can allow a person to go and to receive what they want. So, but we are very limited by the since we have this constraint of moving freely and because of the virus. So it's not very easy to reach people in order to give them the vouchers. The best way which is working until now is to provide code, but this way we are very limited because we don't have relationship with others shops in others area. So until the end of this week, we will be able to apply what we are doing with a supermarket and stuff. I can say something regarding the situation of new mothers. They are very vulnerable. So here in Athens, people, most of the refugees, they used to live many in the house, and you have a woman with sometime newborn baby, and they are living together, and it's not a very good situation. But now, since all the services of the country is down, we cannot do the kind of relocation of people, of person to other places. It's very difficult for now. So there is a special service for this kind of women that have a newborn or they have a baby. We are in touch with some organization that have some help desk in some area of the city or Athens in general, which provide some basics material for them. Yeah. Thank you.
Thank you, Jan. I will ask Rashid to also give us more information from Central Europe.
Okay.
Rashid?
Yes. Do you hear me?
Yes, we can hear
Yes,
you.
yes, go.
Yes, luckily I'm here. First of all, allow me to thank you all for this great and timely initiative for allowing us to discuss the situations and to give updates about different regions and also to coordinate or to collaborate or to learn from each other's work. Let me allow you to first give you a brief update of the recent changes in policies and political developments as a regard to this COVID-19. And then I will just briefly touch upon the gaps and the needs of refugee organization and refugees across the countries. In recent years, as we have seen, asylum and migration have been punitive and inhuman across Europe. At its border with Turkey and Calais in France, which at many other external borders of European countries. Within Europe, refugees are held in detention centers, living in overcrowded camps with no or little access to healthcare medical system. And also, on other hand, it also left people in legal limbo, which is basically with no legal status, which no rights to medical care and to social services and to social benefits. These are the developments which have been in Europe from the past or recent years, which now have been increased and also increased the risk of these people to being infected with coronavirus. Let me to say, what was the EU's institution response? We have recently seen that the European Commission published guidelines to European member states for border management because we have seen that some of the member states introduced several restrictive policies by not allowing asylum seekers or international to have a right to asylum. The European Commission was very straight away and also reiterated the right to access to asylum across member states and for the non-refoulement or return of those seeking international protection. The European Parliament response was also positive in this report, which the LIBE Committee or the Committee of Civil Liberties in many hearings and many meetings reaffirmed or emphasized the need for solidarity between EU member states to help refugees, to help the frontline countries to overcome this situation, and also in regarding the access to the right to asylum, which is basically the Geneva Convention. So this was actually the responses of the European Commission and the European Parliament. However, the responses of European member states or European countries were something very different from one to another. We have seen on some countries have developed negative policies, some countries develop positive policies. On the negative side, we have seen that the limited to access to asylum have been introduced to some EU member states, such as Netherlands, Belgium, and Cyprus. In Greece, the virus is used to justify new restrictive measures and proposal restricting relating to its borders, which actually means the increased detention, increased return, and also leaving them in a dire situation or in the island situation. On the positive side, we have also seen the Portugal, which introduced the regularization of those pending asylum cases and also those undocumented refugees or migrants residing in Portugal, which give them temporary access to healthcare system, temporary access to social services, which are positive. And also we have seen positive cases in Ireland, which gives the right to access to medical care for those undocumented migrants. In Germany, we have witnessed the suspension of Dublin transfer to EU countries, and so on and so forth. We have, in regarding to this situation, I would like to also acknowledge the contribution of refugees and migrants themselves, migrant organizations and communities themselves, we have witnessed that gradually refugee-led organization, migrant-led organization, and communities, whether be it at the organizational level or be it at the individual level, are also now mobilizing themselves to help the community, to help their fellow communities, to help the broader society, the vulnerable people, through different initiatives and also through different ways. We have seen from the highly skilled refugees and migrants residing in those countries, whether be it in Germany, the Syrian nurses are working in the front line with adult medical staff to treating people with the COVID-19 virus, and also the lowest skilled job, which unfortunately many migrant or refugees are holding those jobs. So people are in the shops and supermarkets and the factories still working with high risks and helping and help the functioning of the society. So this should be acknowledged, and also this have been acknowledged by mainstream politicians from different member states, that the positive contributions of these refugees and migrants. And to just directly touch upon a very small initiative that we have launched at our individual capacity together with the Greek Forum of Refugees, that my colleague touched upon them, is the crowdfunding that we have launched to collect money to support vulnerable people, invisible people, those undocumented people residing in Athens, and also in a way to share this responsibility, or to reduce the burden from the Greek government in these times, and also to be their partner in this time to help those refugees and migrations. Our recommendations as organization, as a refugee myself, at this time are very clear, and I just very specific. We need that everyone should have access to asylum, and access to medical care at this time, regardless of their status, regardless of their nationality or race or religion. We also need to emphasize on that there should be no deportation at this time, be it on volunteer basis or be it on forced deportation, because this is a time that when developed countries are facing with this tremendous work, and also being overwhelmed with the infections, with the rate of infection, then we shouldn't expect less developed countries or people or countries with lower capacity to cope with such virus. And also, I would like to also say this, to take this opportunity, because many of donors are on this, I think some of the donors are on this call, that also really state or encourage them to help financially or financially support refugee and migrant organization at this time of the crisis, and also that they should carry their work and they should carry their functions, and to gain their capacity for this cause. I think more than ever, we all need solidarity and unity to help each other at this time of crisis that every one of us are facing. I will stop here. I will stop here, and thanks very much.
Thank you, Rashid. I think we have Tariq as well. Please, Tariq, don't do it so long, because we need to hear from other region as well, but the floor is yours, and try to make it like 1 minute. Tariq?
You need to unmute yourself, Tariq.
Tariq? Tariq? We are.
Hello?
Yeah, we are hearing you.
Yeah, hi everybody. Thank you for inviting me. Yes, I will try to be shortly. We know Italy, we are suffering a lot. The situation really is so bad. We have now, particularly for those undocumented people, like example, we have a lot of people are waiting in process. It means that does not have a place to sleep, does not have even the government, all the media, even the government does not talk about them. We have a big number. Still, people are suffering. Still, people have fighting to get even food to eat. Now we are trying to push the government, even to some media, to talk about this situation. Still, the number doesn't have really how many of them are infected by the virus. The only that we know in different situations, in particular in those who working in agriculture, last today, the Minister of Agriculture make a statement to take position, the government to make at least like the way have been done in Portugal to be done in Italy. Hello?
Yes?
Yes. It means that we still are pushing different NGO, we're still dealing with Red Cross, with Caritas, at least to try to get some help for those people, not only for place for accommodation, but something to let them to get like what's called food, because the majority of them doesn't have place to sleep, does not have the right to get like this bonus that the government have been giving the Italian people, or something refugee. You have supposed to have a document like for 600 euro per month, but we have like a big number doesn't have right to get this bonus by the governments, and we're still fighting. Some of them are afraid because really doesn't have a place to stay.
Thank you, Tarek. Thank you for these inputs, and I will over to you, Anila.
Thank you, Shazza. Thank you everyone who shared their insight and updates from Europe region. And I would like to request everyone who's ever joining, kindly keep your mic and your camera off, because we're having overwhelming participation of participants from all around the world. So we don't want this call to be collapsed. And the second, if you receive the agenda, in agenda we share our tweets. So kindly please keep tweets, because we really want representation and participation in the social media as well. So I would now like to invite our Asia Pacific region of Global Refugee Led, and over to you, Najiba.
Yeah, maybe if I could add to that, if you could use hashtag refugees rise while you're tweeting, we would really appreciate that. I think I'm already fascinated by hearing from other regions, and I would like to congratulate everyone on the work that you do, understanding how difficult the situation is. As my colleague Christina, who will be getting the PowerPoint up, I'll just tell you a little bit about APNO. So Asia Pacific Network of Refugees is the Asia Pacific regional chapter for GRN, for the Global Refugee Network. APNO recognizes that refugees will be always the first and the last responders to any crisis impacting refugees. Together with our local partners, APNO is ensuring that refugee-led initiatives get the support they need to help, refugees to access to healthcare across the regions. These efforts are even more critical, obviously, at this time, understanding that a lot of the international actors are restricted from travel. We are hearing around the suspension of resettlement. We're hearing around from the international actors not being able to freely deploy to field operations. The global logistics are being fragmented. Organizations expecting to face many more additional challenges to their usual way of working. And hence, I think, just like in many other crises, especially with COVID-19, it has been a true indication that how important it is for the role of local, national, and refugee-led and regional refugee-led organizations to act in, to be those immediate responders to support communities at such difficult time. I do have a lot of my colleagues from the Asia Pacific Network of Refugees who are on this call. We've got Darius, Isaac, Mr. Navid Aind, and a few others who are still trying to join. I would like to actually hand over to my colleague, Navid, who's also part of the steering committee within the Asia Pacific Network of Refugees, to actually take you on some of the actions that we've taken on board to support refugees and to show leadership in response to COVID-19. So, Navid, are you on the line? And if you can hear me, you have the floor. Navid, are you there?
Yeah.
Okay.
I'm here. Thank you very much, Najib, passing for me. First of all, I'd like to thank you very much for the organizations, or the organizers who just brought up this opportunity to for having all our friends from all over the world to talk about this important issue. I'm Navid Ain, a refugee based in Indonesia since 2015. First of all, I'd like to briefly talk about APNOR, or Asia Pacific Network of Refugees. Actually, since I have been in Indonesia in 2015, that was the first year I just been experienced to be a refugee here. We had no one to take care of the community, and also to combine, like there was no bridge to be in contact with the region and also with overseas, due to the very important issue which was growing up in the refugee community. And that was a fortune for us, since we have APNOR, or Asia Pacific Network of Refugees, that we are in contact with the region and also overseas. We do appreciate, as far as we have no rights of education or having like access to the health issues in this country, in this transit country, since we are here. And recently, a kind of hope is just growing for the refugee community here in Indonesia, since we are having APNOR. And what we are doing in APNOR, first of all, I'd like to say, like, as you can see in the map, APNOR is covering 12 countries, who are Afghanistan, Australia, Hong Kong, India, Indonesia, Iran, Japan, Korea, Malaysia, New Zealand, Pakistan, Thailand. And who are APNOR members, a group of refugee-led initiatives, networks and advocates that works with and for refugee. To do what? To increase refugee participation in shaping policies, to support the strengthening of national refugee-led entities and assist them to influence national policy reform, strategically advocate for and promote inclusive human rights approach to forced displacement people. And what we have been done so far, and also it's the action plan for APNOR, which has 3 important fields or sections. I have a note here, and I'd like to just read based on the note. The first section, due to the current condition in the world and also in Asia region, is the first section, communication gaps and community awareness. So what we have been done so far, and also we are just planning to do that, is we have just conducted 5 fortnightly community safety call checks on COVID-19 via WhatsApp, Facebook, with 70 people in the region. And also we had 40 telephone surveys on COVID-19 issues with refugee women, including undocumented, as well as we just held 1 national virtual meeting with asylum seekers and 5 fortnightly meeting with Asia Pacific Leadership Committee. The second section, which I'm talking about, is producing advocacy and country reports. Actually, in this part, we have the countries which we have just talked about in our very recent meeting, was Iran, Australia, Indonesia, Malaysia, Bangkok, India, Afghanistan. And we have just prepared and produced 10 short videos of refugee nurses, which has been broadcasted already. And the third section is data tracking and life-saving information materials. We have produced 2 audio podcasts on COVID-19, which was in Persian, Farsi, and Arabic. And also, we are just working on the bilingual language because the community are in need of that, like in English and also other language that the refugee community are in need of them. And we have just held 2 online live conversations with refugee doctors in Arabic so far, and we are just planning to do that in other languages as well. It was due to COVID-19 prevention videos by refugee nurses for, just we had produced and broadcasted another videos which was just acted by the refugee nurses. It was a COVID-19 prevention video for elderly in Dari language, for those who are not able to read, and also for illiterate people, which is very important, especially in the refugee community. And for the plans and the action plans that we are running nowadays, and it is on our discs, it's on the top of our discs. We are just in need of supports and looking forward for the donors to help us to just support us. In the last slide, can we have the last slide? We have the tweet hashtag over there, and also I'd like to ask all our colleagues, our friends, please share and use the hashtag of refugees rise to get more attention, and also to get over of this challenge which we are just facing currently. Thank you very much.
Thank you very much, Navid. I know it's a very difficult job to do when you're actually online and trying to do it from a PowerPoint, but you did an excellent job. Thank you. Maybe I'd like to invite Darius as well from the Asia Pacific to also share his views and experience from the Asia. Darius, do we have you there?
Yes, can you hear me?
Yes, we can.
All right, so I'm not sure if I can show myself with the video. I'm checking something is not working, but yeah, all right. So in the Asia Pacific, we actually emphasize a little bit more on how we can actually come together and make sure that we are all on the same page and try information, about whatever is going on in all of the different. We have quite broad network right here with many other countries, involved in the network. So what we're trying to do is to make sure that we actually support one another with the difficulties that we are experiencing in different countries. I'm based in Hong Kong, for example, and maybe some of my colleagues based in Iran are also having different other struggles. So how do we come together and find solutions for these different issues, being united? So this is one of the things also that we actually work a lot in, and we work a lot about. And in the recent COVID-19 outbreak, we had so many calls to try to see how we can intervene for different regions and see different countries and see how the struggle they are having, how we can provide solutions to it. what are the situation on the ground, and what can we do for the people that are, struggling. For example, in Iran, some people may not have access to medical welfare, or maybe they may not have access to different logistical stuff to deal with the outbreak. So how do we provide, support for that? So this is one of the things we are trying to do. How do we raise funds so we can allocate to different regions based on different countries based on the needs that they have right now? So it's quite a kind of support network also we have for our different refugee-led initiative in all of the countries. So this is what I want to add to what Navid just mentioned. Yeah, thank you.
Thank you very much, Darius, for that. And with that, we would like to now move to our North America region. And do we have Cedric on the call? Cedric, I'd like to invite you to share your update on the region. While we're waiting for Cedric, maybe, do we have Dr. Hani? Dr. Hani, are you on the call?
I'm the call, yes.
Excellent. Maybe we will start with you, Dr. Hani, as we are trying to hear from Cedric.
It's okay. Are you hearing me well?
Yes, we can.
Okay, let me try if I can put my camera on. So, cool. Yeah, thank you very much for having me here today, and always it's a pleasure to be with my fellow refugee around the globe. Uh, Greetings. I'm based in Toronto, and good afternoon to all of other people, and good evening there. My name is Hani Bashir. I'm a refugee from Sudan, uh, specifically from Darfur. I immigrated to Canada on 2017, and I'm lucky just to mention that Canada now it's kind of my home. Uh, I know that being a refugee, and I understand that it is very important always to acknowledge that we have been through a very difficult time, and sometimes when you just move to the country, you always try to give more. Uh, just I will give a very quick background about what we are kind of doing now as a refugee. After 10 months of my arrival to Canada, myself and other kind of fellows, medical professionals, we co-founded a refugee-led organization with the vision that we need to empower communities and improve our healthy and the health of the refugee communities. We call it IHSN, Immigrant Healthcare Support Network, based in Toronto, and we try to bring all the international medical health professional refugee who they are migrated to Canada to bring their expertise and to advocate and support access to quality healthcare service in Canada and around the globe. Uh, this is kind of part of our work, and the aim of that, we always envision that everyone has a right access to quality healthcare service as our fellow Canadians in Canada here. And we also try to mobilize the refugee health professionals to the kind of professionals here in Canada to equip them and to use these kind of untapped resources to support the Canadian system. In regard the kind of COVID-19 work, we established kind of many different programs, and I could just mention that very quickly. We put what we call it Healthcare Support Network program, and we put also youth and health education. And the last thing I would like to share now with this slide, we put what we call it by refugee and for refugee project. So this kind of project, which is allow us to support and to advocate for the challenge which the refugees are facing in Canada here in their own language. So kind of putting the educational materials and all the updated kind of updates about COVID-19 in Canada and around the globe with their kind of language. We started with the kind of the language which are kind of Arabic, English, Swahili, Amharic, Somali, Lugano. Most of these languages are not available in kind of most of the Canadian context. I can just speak briefly about the updates or the challenge the refugee are facing in Canada here. And I want to echo my kind of my friend, the director of FCJ Refugee Center, one of the biggest refugee center in Toronto here, which has been established almost 25 years ago. He mentioned that, people and refugees are scared during this time about this pandemic and about their future. They are kind of worried about their healthy, about their families, and also about the impact of COVID-19 in their life. Of course, this is a very difficult time, and I can say that we as the refugee were facing kind of wide, broad challenge. I can sum them in economic challenge, lack of communication and access to the information, and also lack of the access of benefits from the government. Also kind of processing their immigration and refugee status, probably I don't want to jump on that, but you know that now the border between Canada and the United States now has been closed. So no one can just pass between the two countries, and this kind of been put many of other kind of refugees on a strain in the border. While the government of Canada, I think they are doing good work by addressing this kind of economic situation and challenge for refugees by issuing emergency benefits and also support programs. Still, we are as a refugee, we kind of lack access to these benefits, and also we are not sometimes eligible to these benefits. Again, refugees, they lack access to quality healthcare service because some of us, we don't have the identifications. Some of us also, we lack the proper communication because due to the language difficulty, so we kind of having that difficulty. Of course, we know that the employment, this issue now during this time, many countries, they lay off a lot of kind of even citizen and refugee, they will be kind of already highly affected about that. On the other side, there is a kind of bright side of this also I would like to acknowledge. We are as a refugee in Canada, we got that kind of leadership and also empowerment. There is a kind of large organizations, a refugee-led organization has been included in the Canadian Council of Refugee. So in that regard, we are trying to advocate and create a campaign to support each other and also to try to share that network together where we could be able to advocate for each other and also to support our work. Refugee-led organization like our organization IHSN, we're also trying to create platforms. We know that we have skills and we have the talent, so we're trying to create a platform in our language, which kind of most of the refugee can speak, where they will be able to access the information accurately and to also to summarize for them all these kind of things. There is also kind of other refugee-led organization by my fellow Mustafa Aliyu, which is Jumpstart. This is kind of playing very crucial role here. We're trying to connect refugees and advocate for refugees with the employers. We know that sometimes some employers, they can see that refugee, they are not qualified for this job or they are not kind of having the good education background. But of course, by refugee-led organization, we always try to advocate. Jumpstart is trying to advocate for refugee and also by empowering refugee through creating different internal training programs, educational programs, and connecting them with the business so they can start fresh start with the labor market. I think our role is kind of very big and very kind of challenging during this time, but I would like to acknowledge that by creating such a platform like this and connecting and sharing our ideas and thoughts, we could definitely can make a difference in our new homes and also support our refugee in the fortunate areas back. Thank you very much for giving me this opportunity, and sorry if I took a long time for my friend Cedric.
Najiba, you are on mute. You gotta unmute yourself.
Sorry. Thanks, Mustafa, for reminding. This is what colleagues are here for, isn't it? Thank you, Dr. Hani, for your contribution. I just want to call on Cedric. Do we have you or not? Okay. Maybe I'll call upon Basma Alawi from Florida in US. Do we have you? Basma?
Yes.
Basma Alawi?
Yeah.
Okay, please. We'd love to hear your experience from the US region.
Thank you so much. I really appreciate making this platform and bringing refugees, leaders from all around the world to discuss how COVID-19 had been impacting the refugees community worldwide. Thank you, Sheza, for always for your leadership and including people from all around the world. Also, this is my first interaction with the Global LED Network. This is a great initiative. I am Basma Alawi. I am a Florida refugee organizer for the Florida Immigrant Coalition. We are part of the We Are All American national campaign. We advocate for refugees around the country, but also we educate our communities here in the U.S. about how the U.S. foreign policy have affected and created more refugees, and how we could be an advocate for refugees worldwide. Since COVID-19 situation started, every week the needs have been different. I think the first week was more on educating our communities and filling the gap between the government and leaders with our communities in terms of refugees. We tried our best to make sure our communities have access to different languages and also hearing the right news, because we know social media sometimes can be really crazy. So we want to make sure also that our communities have the right information in the right time. Also, so for pretty much the first couple of days when COVID-19 hits, we want to make sure that our community is aware and they stay home and that their basic needs are met. The second week, I felt like it was more on how to get tested, what I need to do if I don't have health insurance, who I need to reach out to if I have the symptoms. So it's pretty much was covering all the kind of concerns when it comes around health issue. We are now this week in a different stage. We have many of our refugees community have been laid out from work or left work because they don't feel safe depend on what they are doing. So we are now in a stage on finding ways to apply for unemployment for our communities and also help them finding some kind of cash assistance. The government here in the U.S. Have been providing some kind of programs for cash assistance and unemployment. We are still, most of our community is still confused still about the new assistance and the new role, but we are trying to fill the gap and educate our communities about what they should do from home. We know that most of our refugees community, they do like the one-on-one interaction in person, but pretty much we are trying to help them while they are home. We are also trying to do different kind of assessment with the refugees community. We are holding different kind of national, statewide, and local webinar in different languages to educate our communities about the assistance that the government providing, but also to listen from them and hear from them. And we are starting different kind of series of interviews. It will be on YouTube. I can share it with you guys so people could hear from refugees here who are also still connected home about their experience here, how the experience of COVID-19 have triggered some kind of emotion for refugees who lived in war and they needed to be isolated for some time because of because that they have some kind of history of being in war and staying home because of a specific situation. Plus the webinar, we are still advocating for our refugees to get their needs. I know some of the concern we had, most of the cash assistance and unemployment goes to refugees who've been here in the country for at least more than a year, because the cash assistance goes actually to people who have tax return. So if you are less than a year and if you were settled in the US in the end of 2019 and the beginning of 2020, you don't get the cash assistance. You might get unemployment, depend on your situation. So we are now advocating to have cash assistance or unemployment to everyone, no matter of what is your status, if you are undocumented or a refugee who just arrived to the US. So our advocacy efforts still continue to make sure everyone included, because we know that everyone is going through a lot now. And we are also trying to advocate for the US to support also refugees worldwide, and to donate money to refugees in refugee camps. Thank you so much.
Thank you very much, Basma, for your contribution. We do understand that we've already run. We are not really ahead in terms of the time, so we would like to go to the Latin America. So can I call on Maria Elen? And I do understand that you're going to speak Spanish, so, and Mahfouz is going to support with the translation. Good to see you, Maria, again.
Hello.
Maria, hello, Maria.
Hello, morning. My name is Maria Elena.
Excellent.
In Chile, received an affectionate greeting in the distance. My participation is a representative of the Latin American region on the GRN network. Our friends Mahfouz, I have met read. Bye.
Thank you very much, Maria. Mahfouz is going to read the prepared statement from Maria from the Latin America, and Mahfouz is going to actually read that out. Mahfouz, you have the floor.
So generally the text that Maria sent to me is just a quick update on the situation of Latin America. Like Latin America said, Latin American governments are much worried on the economies of their countries rather than the situation of migrants and refugees, and preserving their rights. Now Chile, for example, counts more than 5,000 infections of the coronavirus, among them 100 childs, and it's a big quantity taking into consideration like Chile is having only 18 million inhabitants. So migrants and refugee communities they feel very affected by this pandemic, and particularly that this pandemic is affecting their livelihoods, as many of them are working in informal and an independent way, and now the self-isolation and social isolation is impeding them to do many of the works they do in different refugee communities. And now in case of Chile, for example, UNHCR has not started the problem of humanitarian support to applicants of refuge and asylum seekers as well, and the supports are being managed by organizations of civil society in Chile and also in other countries of Latin America. And here also Maria Elena sent some information about the number of infections by coronavirus in different countries of Latin America. Like for example, we have 6,900 in Brazil, 3,000 in Chile, 2,000 in Ecuador, among other countries of Latin America. So this is shortly a brief update on the Latin America region. Thanks.
Thank you very much, Mahfouz. Maybe I would just like to call on Papi Patrick from the Kizibia refugee camp. We didn't give an opportunity to other people from the Africa regions other than Robert, I think. So if we have Papi Patrick from the Kizibia camp, are you there? Do we have you on the call? Do we still have you on the call? No? Okay. Oh, yeah, you do. Okay, I can see you. Yep. Hi, Patrick. Maybe it's better to speak without your camera. I do understand that a lot of people are actually text messaging saying that the internet connection is making them leave and reconnect on and off. So therefore, we again would like to ask everybody to have their cameras off, so that way we can have better network connection for everyone. We lost Patrick, so maybe I can ask on Stefan from Uganda. Are you there? Stefan?
Yes.
Yes, if you can keep your comments very short, at 2 minutes, please. Thank you.
Yes, this is Stephen from Uganda in Bidibidi refugee settlement. Most of the things that have been mentioned are already there, but I would like to highlight a few things that is happening in the western Uganda, in northern Uganda, and the refugee settlements around. The total ban on travels and transport to the refugee settlement is now cutting off the supply of basic needs to the refugee settlement, and it is actually a concern because refugees are not able to access some of these things. Most of things are brought from the town center. Then also there's no preparation or any measure done on ground for the refugees in terms of awareness. There's a minimum awareness to the refugees, and there's also no things, basic item like soap and hand washing items that can be provided to the refugees. And basically for children whom we work with, there's really a lot of gap in providing awareness to especially unaccompanied children in a context that can be of children. So this is why we are already organizing and putting together programs and seeking support to reach out to the unaccompanied refugee children and see how we can be able to help them in this situation. So basically the refugee-led organizations on ground are well mobilized and are working in getting more support so that they can be able to reach out to the people. But the fear remains that the lack of preparation and the measures on ground in case of a break up of this disease in the settlement is really a worry to all refugees because there are no hospitals around. The centers are very far in the district and refugees cannot access. So there are only one ambulance in most of the zones, and with the population and everything is really a worry given that no proper measures and proper awareness has been put in place up to the moment. Thank you.
Thank you very much on that. Maybe we can give 2 minutes to join again. Do we have you, Patrick? Patrick, do we have you? Okay. Okay. All right. So what we will do, we will have much more opportunity in the next sessions within this call. So move on to agenda item 2, which is partnership and solution. And once again, please do mute yourself if you're not speaking, and only unmute when you're speaking. So with that, I would like to tell you a little bit around, why we actually have put partnership as an agenda item. Anila briefly said in the start that for many of the refugee-led initiatives or those of you who are on the call, it was very important to actually, unpack what exactly do we mean by partnership. How do we make sure that we are able to build and implement partnership models that ensure equal access and co-ownership with refugee-led organizations and refugee advocates? we've heard a lot through all of these examples from the regions that refugees are able to self-organize themselves. Refugees are able to actually act as contributors and be part of the solution. But what can we do that we can become, an alliance partner to those who are not necessarily have the means to be within this crisis emergency situation to COVID-19 now? With that, I really would like to, bring all of your attention. What do we mean by partnership? I really want to hear from people in the call, either through the chat box or from those who are going to speak. How do you see partnership, or what kind of partnership exists on a local level, and on a local level, or from the local to national and regional? And do you, if there is any kind of partnership with the activity that you do, with the initiative that you run, do you still have that sense of ownership, agency, and representation of what you do? And with that, I really also like the speakers to reflect on your relationship with the donors, to reflect on your relationship with private sector, to reflect on your relationship with UNHCR, with NGOs, and again, we have them all on the call, and they're listening to what you're here, to what you have to share. So it will be really good to kind of look at, what are the best ways to actually increase better representation, better leadership around partnership. So with that, I actually would like to call on Mas Mahmoud from Tech Refugees. If you are on the call, to actually share with us your experience on this. Mas Mahmoud from Tech Refugees.
Hi, I am replacing Mas Mahmoud. Hi. Hi, I will be replacing Mas. Unfortunately, Mas is unwell. We don't know yet if it's COVID or not. He has given me a bit of a brief of what he wanted. He's deeply involved into refugee representation. So I'll try to be his best voice today. Thank you for organizing this conference, and thank you for recording this conference. I think it's important that a lot of people that are coming in and out can reconnect later to what is being said. Having been on this call for just a few minutes, what is said is really important. On our end, so just a few words about Tech Refugees. Tech Refugees is an organization worldwide. We're on the 5 continents through volunteers. And what we do is we have a conversation about how technology can be empowering displaced people, and how these technologies can be done with displaced people, not for them only. So part of our team is obviously like half of people with refugee experience, as well as our board. And the point here I wanted to make about partnership is that it is essential that in any partnership discussion, at least on our end, that the end user, the people that will be beneficiaries, for some people calling it this term, are part of the meetings. So it is really important for us that they are part of those negotiations. And this means that the discussion doesn't happen like a closed door discussion. It's a transparent one, with at stake the interest of the refugees. One thing that I'd like to highlight on this call before I give the floor to everyone here, we've called on organization helping refugees on the ground and refugees themselves right now to report what's happening on the ground through an open document. So we're able to map what is everyone doing right now to help protect refugees from the COVID, but also protect refugees from harmful policies that are passed on the excuse of COVID. So we also mapping this. We've seen ways of EU governments putting in limbo some asylum seeking processes, saying that they can't continue processing asylum seekers as usual, which is an interesting excuse, as other countries like the UK or Portugal more extremely have decided that everybody will be granted residency status as long as the lockdown happens. So there are different ways to react, and they're important that anyone who is a person with a refugee status or the experience of refuge is part of that discussion. That's it. So about this document, if anyone on this call is interested to partner and highlight what they're doing and what need the help, Tech Refugees is present to be listening and to be helping. Thank you.
Thank you, Josephine, for sharing your update. And as we are in this section of partnership and solution, we are talking about different angle and different themes. And I think gender is really, really important, which we shouldn't ignore when we are talking about all the insights and COVID responses for refugee-led initiative. Because gender, women, migrant and refugee who are living in the camps in the refugee area or even in the urban camps, they are facing more difficulties, they are facing more problems. So therefore, I would like to invite Linda from Australia. Linda, are you online? Linda, are you online?
Yes, I am. Hi,
Okay,
Nida.
thank you. Yes, hi Nida, nice to have you. So I will like you to say something about gender importance towards COVID-19, and floor is yours. Thank you.
Thank you. Look, I just want to say thank you to you and Nila and Najiba and Shaza. We've all been working together for a long time, and I know how committed you are to issues, particularly for women and girls. As you know, and others on the call may not, we've been working very closely with refugee women-led groups, particularly across the Asia-Pacific region for many years, and currently in a project looking at implementation of the commitments as part of the Global Compact on Refugees. So like many of you, we are continuing to hear really concerning things from both refugee women, NGOs, UNHCR and other UN agencies. So some of the things that the women we're talking with and that we're particularly concerned about include issues like the dramatic increases in reports of domestic violence due to confinement because of social distancing, less access to support services for women, referral pathways being completely cut off, no access to justice, no access to what safe houses may exist, real concerns about increased risks of survival sex for food or shelter or medicine, increases in risks of forced and early marriage in the context of increased economic insecurity due to loss of livelihoods. And we're talking about these issues in camps, but also in urban areas. I think these are touching all contexts from Europe to Africa to Asia. Lack of accurate information, many of you on the call have mentioned, but particularly for women and girls who may not be able to move freely in certain camps and areas, so they're not getting information. A real concern around lack of access to sufficient water, so that even if soap might be available, particularly in many of the refugee camps, there simply isn't enough access to water. And that has particular impacts on women and girls, both in terms of accessing enough water for the household, the increased risks of having to repeatedly go to water points, increased risk of sexual harassment, real issues for women and girls who are menstruating, who may not be willing to access shared bathrooms because of fear of COVID, lack of water to wash reusable sanitary towels because buckets may be used for water storage. Lots of real concerns about access to sexual and reproductive health services. Many of Eileen, my colleague, was on a call the other night with some 3,000 NGOs and service providers who were incredibly concerned about predicted serious shortages of access to contraceptives, to safe abortion pills, and that the consequences of that are going to force more women into self-induced abortions and death. All of the concerns associated with isolation, social distancing, lack of hospitals, which will lead women to give birth at home. I guess one of the important points that many of us wanted to emphasize is that this COVID crisis, as you're all saying, comes on top of the issues associated with gender equality already faced by many refugee women and girls, and on top of many of the existing forms of sexual violence. So that COVID's having a kind of multiplier effect on the risks that they're facing, and that of course within those communities, those who are particularly vulnerable, women and girls with a disability, the elderly, those in the LGBTIQ community are facing even further risks with social discrimination added to that. And I think the horrible reality is that the existing guidelines, frankly, are useless in the current context when so many services and humanitarian workers are pulling out because of government restrictions or their organisational rules. So what you're doing in terms of working out ways to provide direct support to refugee women-led initiatives and others on the front line who really are the first responders is absolutely critical. And certainly we at the University of New South Wales are really keen to provide whatever support we can to current initiatives. Thanks, Anila.
Thank you so much, Linda, for sharing this update. So now I like to give the floor to Hadi. Is there? Hadi? No. So okay, I like to introduce Mustafa, who is there. So Mustafa, hand over to you.
Yeah, thank you, Lila, and thank everyone for joining on this call. So my name is Mustafa Alio. I'm one of the co-founder and managing director for Jumpstart Refugee Talent here in Canada, but also one of the other hat I have is that to advise the government and hopefully work with many other donors on trying to empower and create that direct relationship with refugees, refugee-led organizations on the ground in Canada and different regions. And I think just kind of to bring us back a little bit on terms of what's a meaningful partnership is, and then we've seen a lot of form of partnership, and I think a lot of refugees do realize that we always hear this term as a refugee-led organization are an implementing partner. It's a good also to know that less than 2% of resources being spent on, let's say, on refugees or to create programming for refugees actually go to refugee-led organization. Meanwhile, refugee-led organization and local organization on the ground do at least 30 to 40% of the work. They are always the first responders, and they are the last to basically stay still. COVID-19 was a great, or just another example of the fact that when the whole international community is paralyzed and can do nothing, or even INGOs, where most of the staff are not basically operating right now, we see refugee-led organization rising and basically trying to take on those responsibility. What I wanted to do in this kind of, the short time we have in this part two is really kind of to play this challenge game where I wanted to identify, based on my conversation with government officials, with other foundations and all of that, what are the really gaps that we always hear from them saying or basically the areas where they feel there is a challenges in partnering with refugee-led organization on the ground. So I hope this kind of, I'll mention a few things. I wanted to hear from anyone here on the call if they can add to those kind of let's say statements that they hear from direct donors or even like INGOs on why there is a challenge of, let's say, having a direct partnership, a real partnership, not implementing partner. And what I mean a real partnership, that means involving in the decision making, involving in getting a portion of those resources, involving from day one, from point zero to any kind of program developing. And then after that, maybe we can talk a little bit about the gaps that were identified by us as a refugee-led organization. What are the gaps that we feel that donors and INGOs and governments have, or they're missing, and they should listen to those and then maybe pay attention to those gaps in order for them hopefully to address them after. And then after that, definitely we'll just gonna end that section by hopefully proposing some solutions. I know that it's not kind of, it's a way where we can brainstorm a solution right now, but even if someone could let us know about some of the examples, some of the proposals they might give us as an ideas, or even best practices or an examples that there was a direct relationship between refugee-led organization and a donor. So in terms of the gaps that we always hear from, definitely, let's say donors and then others and governments. I mean, we hear a lot about the fact that there is like 1,000 and more than 1,000 of refugee-led organizations. So how can we identify those refugee-led organizations or create a direct relationship with? There's also the gap of that some or many refugee-led organizations are not even able to register, for example, in some regions. In Africa. So if you're not registered, how can we actually create that partnership? How can we know? There are basically, I mean, I hear a lot is like, okay, we need an organization to have an audited statements. We know as a refugee-led organization, we're always so busy doing a lot of work on the ground and trying to help others than being able, we don't have the resources to establish such a governance or structure an organization to basically come up with statements and all of that. At the same time, today, what unique about COVID-19 situation, it's the first time where the whole international community feel kind of paralyzed that they cannot do anything. I think the only solution right now for them, just trying to really make that partnership. And even when they are at this level of, let's say, desperate to find a partner on the ground, to do the work, to deliver what they're mandated for, but they're still having a lot of putting a lot of layers of obstacles even to create that kind of partnership with refugee-led organizations. And at the same time, so the structure, the governance, the statements that we need to have a registered, we need to have a partner and all of that. So those are kind of the gaps that I keep hearing from directly from donors when it comes to creating that partnership with refugees, even though they understand and they acknowledge all of them, this is the ironic one, where they acknowledge that refugees are the one who's doing the work on the ground. They acknowledge that the fact that we are the first responders on the ground. So I want to open the floor and just like hopefully to hear from anyone, like what are the other gaps or challenges they're facing or they're hearing getting directly from donors, governments, give it, or INGOs or foundations that they can share with us on here.
Thank you, Mustafa. And maybe if I could just add one comment to that is that, again, through the Eventbrite survey questions, we heard from most of you that financial support has been a gateway to your participation. And for many of you guys who are running refugee-led initiatives or are basically requiring advocacy support around this, all actors basically who are here as observers to this call, we tend to believe that you have a role to play in financing refugee participation, specifically, as Mustafa said, in relation to COVID-19. And how do we make sure, or how do we facilitate interactions, with the whether it's the host states or the donors or the influential bodies in a manner that is ethical, sustained, safe, and supported financially. I think that's really important. And with that, maybe if I can actually call on Patrick. Patrick, I think, are you there? You've had few. We've actually received good contribution from you offline as well as online now. So if you are back on the call, would you like to share it with us? Patrick, did we lose you again, or you're there? Patrick from the Kizibia? Yes, you're there. We've got you now. You got to unmute yourself. Papi, you're muted. If you're speaking, you're muted. We can't hear you. Maybe Rebecca can. Okay, we can hear you now. Is this Patrick? Rebecca, do we have a way to unmute him or?
So he's actually muted himself. I'm trying to unmute him, but it's not quite working. So Patrick, if you're able to, there should be a microphone that's got a line through it. So if you could try and click that, and then you could unmute yourself.
Sure. So maybe with that, so while we are actually waiting for Papi, I think we're still having difficulty with him. Are you okay? Can we get Samuel and Alboni, maybe one of you to actually share your update as we are trying to figure out what's happening with Patrick's mic? Do we have Samuel on the call? Samuel? No? Okay. Yes, we've got Samuel.
Yes, hello.
Hi, Samuel.
Yeah, this is Sam. Hi, this is Samuel Mijuanga from Dadaab, Kenya. I'm a nursing officer working at the camp, Ifo Main Hospital. I would like to say that there is quite a lot that has happened at the refugee camp in terms of preparation.
We've lost you. I think. Are you still there, Samuel? I think you're muted. Yeah, we got to wrap up.
I'm still there. Can you hear me?
Yes, we can.
Okay. Now I was saying, okay, thank you. Now I was saying that there is a lot that has actually happened on the ground in terms of response and preparedness towards the COVID-19 crisis. And these activities have involved the refugees at different levels. Now, so far, we haven't had any case confirmed in the refugee camp. We have 3 camps in Dadaab, that is Gadera, Ifo, and Dagahale. But in all the 3 camps, we haven't had any case reported. Although we have had some false signals, like about 6, but none of them met the criteria for diagnosis as COVID-19. Now, among the activities done include sensitization of the refugee community, and this sensitization, the refugees themselves are being involved to sensitize their fellow refugees. Now, the persons involved here include community health volunteers who have been taken through training concerning COVID-19 on different topics, which includes transmission and ways of prevention and what to do in the event that there is or you suspect. Now, the community health volunteers have been trained and they continue giving out this information to their fellows. Apart from that, we have also involved community leaders and community religious leaders who, before the closure of the religious meetings, they used to disseminate these informations to their fellow refugees so that they get prepared and to avoid take measures to avoid contracting this disease. Now, I must say that there is a lot of potential within the refugee communities, especially among the youth, because we find that, yes, people get opportunity to go for different levels of education, maybe like primary and secondary, and then after that we find that people just get stuck. And so this is a good population of young men and women who are able to be involved in different levels of implementing refugees activities. Now, we find that we have people providing different services from different areas. Now, these are services that even the refugees themselves, if they were to be empowered, then they can provide these services to their own people without necessarily involving others. It's just a matter of empowering them. Now, one thing that many people have noted is that it's just a matter of goodwill from supporters or maybe donors or governments, goodwill to support the refugees. And if that can be there, it would be very, very nice. Now, there are, for instance, I'm running a project that is aimed at strengthening the capacity of the refugees to take care of their own health and be healthcare providers without necessarily relying on the host community or the national staff or the expatriate community. Now, this is a project that would enable them take their own, take responsibility over their own healthcare. We know that healthcare service is one of the most expensive projects within the refugee camp, and it takes like more than half of the total refugee budget. Like right now, we are expecting to respond to COVID, and in many places we can see that they are overrun, they are short of healthcare workers. But if if we were to draw this from the refugee community through training them, we'd find that there is so much that we can tap from the refugee community. And so, just to finish, I would like to say that there is a lot of activity going on in terms of preparing them. We have hand washing facilities. They may not be adequate to cover every place, but there are ongoing improvements to make sure that the people get access to hand washing facilities in different blocks within the camp and at the healthcare facilities. And I would also want to mention that we have already set up isolation center for responding to for isolating anybody who was shown who was shown the COVID-19 symptoms. And there are also there are also measures to pick these symptoms or cases, that is through surveillance measures within the refugee communities. We have people that have been stationed within the refugee community, that is the community health workers, who are out and alert to detect any single symptom that somebody may display. Now, when this happened, we already have an established isolation center within the refugee camp. It's called IFO Main Hospital, where it is specifically designed for putting those who have shown these symptoms. Thank you very much.
Thank you very much, Samuel, for your contribution. I would like to again draw everyone's attention to the chat box. We really, Mustafa has highlighted some few key gaps when it comes to financing your activities, and we've heard a lot of initiatives like getting from providing clean water or providing sanitation materials to COVID-19, or producing translated materials, creating podcasts and videos. It would be very interesting to hear from those of you who are on the call, how have you managed to get the financial support to deliver these activities? Have you had much more interaction with INGOs, or have you had any direct relationship with donors? And if you had a relationship with those donors, what were some of the challenges? What were some of the key asks? What do you see as the main obstacle when it comes to that direct engagement with the donors? What are some of the challenges, in terms of the relationship that you've had trust or the third party organization like INGOs? Do you guys have access to a bank account? Do you have the authority to registration? And if not, what are some of the other pathways that do you use to receive aid and resource? And again, these are really important because again, earlier we did mention that, especially right now in this emergency situation, the international actors are really withdrawing, and that's not because they want to, they're actually forced to. We see a lot of, the borders are closing, the transports are getting locked down, there's no more traveling happening. So how do we make sure that the refugee-led groups and refugee-led organizations, especially those that are delivering services, how do we make sure that you're able to still receive direct support from donors, from governments, from INGOs in a much more faster way? And that's why I really want to invite you all to actually reflect on those questions and maybe to provide your feedback with us. I think we already, we've got, maybe I can go to Marhula, and if you want to make your comments.
Yeah, thank you, Murula. I'm ready in Uganda, Kampala. On our side, we used the available means we had personally. We never got any chance of having any sponsor. From January to December, as we saw it happening outside there, we started preparing our communities, sensitizing them on good practices about good environment and how to use, because it's part of our environmental sensitization. And the time it came this side, they already informed. We had already prepared something on our own. So through our contributions, some money we had saved already is what we used on our level to help those that we have given some food, some relief items, some NFIs. Like in our area, in our community, people were like, they are reluctant about this. They are not taking it as much serious as it is. They were like, they don't bother. So we